Worried about catching all those x-rays? Good thing it's Dental Hygiene Wednesday. I'm Christina. I'm the lead hygienist here at Dublin Dental Care, and I want to welcome you to our Dental Hygiene Wednesday. Every week we like to cover different topics or products that we use here or believe here in our office. Last week you got to witness our first hygiene minute that we did this year. We'll throw a couple of those in here and there throughout the year. We're excited to have those. This week, however, we are going to talk about radiation safety and what we're doing to make sure that our patients are getting the least amount of exposure to radiation or x-rays as possible. There are several different things that we do to help make sure that our patients are not being overexposed to x-rays. The first is this beautiful lead apron. It's nice and heavy, but it also helps protect the thyroid and other areas of the body, the areas that we are not wanting to have exposed to the radiation. So this is used every time you have an x-ray. The pan apron's a little different, but it's still the same exact thing, still protecting you. We also use all digital x-rays here in our office. Every room is equipped with an x-ray head, and our pan also is digital. This means that you are getting 95% less exposure to radiation, which is great. That means, every time we take x-rays, you're getting less radiation than what you used to with the film. We also, when we take x-rays, follow ADA guidelines. So we take x-rays depending on the individual. If you have a high cavity rate, then we're going to be taking them every year to make sure that we're checking in between all the teeth to see and make sure there's no cavities that are forming there. However, if you have a low cavity rate, we normally tend to take them every year and a half. That way you're not being overly exposed. That could always change. If you all of a sudden come in and you have 4 cavities, then we'll start taking them every year. But as long as you have a low cavity rate or caries rate, we will do every year and a half. Our full mouth series is a series of x-rays that we take that helps us show everything in your mouth. It shows us in between the teeth to make sure that we have no cavities, and it also shows us the roots of the teeth to make sure that there's no infection going on at the root tips that we can't see just by looking in your mouth. That is a lot more. There's 18 total pictures. However, we only take those every 3 to 5 years. That way we're not exposing you any more than what we have to, but we're still being able to check all the areas in your mouth to make sure that we have a comprehensive look of your whole mouth. We want to make sure that our patients are safe, and their safety is our #1 priority here. So we stay on top of making sure that we're following the guidelines and that we're using the proper instruments to do so. I want to thank you for joining us. If you have any questions or comments or likes, feel free to leave them on our Facebook page or YouTube page. All of our previous videos are up there also, so you can check those out and leave comments or likes. We love seeing those. If you have any questions for me, you are always welcome to email me. My email is christina@dublindentalcareohio.com. And feel free to check out our webpage. It's dublindentalcareohio.com. You can even set up an appointment from the page. So we look forward to seeing you, and we hope you have a great week.